All right, let's address cancer. So cancer is an abnormal growth or a mutation of the cells. When metastasis occurs, that's when the original mutation has then spread throughout the body to other parts, and that's when you're in trouble. Incidence and prevalence rates for cancer are both increasing, but the mortality rate overall for cancer is decreasing. So more people are being detected with it, less people are dying from it. It is the overall #1 cause of mortality in Australia when you combine all cancer types together, and CVD is second. Lung cancer is the single individual cause of mortality, and by the time an Australian is 85, there is a 40% chance, or 2 in 5 Australians will be diagnosed with some sort of cancer. So some risk and protective factors for cancers, all right? Age, gender, family history, the big three as our non-modifiables, all right? We know that the older you are, you're more likely to get cancer if you're a male and if you have family history. Modifiable ones, smoking and vaping, excessive UV exposure, being overweight and obese, poor diet, low exercise, alcohol consumption, all right, drug usage. All of these things can lead to cancers, and specific ones, all right? So if you're smoking and vaping, you're more likely to get lung and throat cancer, excessive UV exposure, skin cancer, etc. Protective factors are actually the direct opposite ones of these. So smoking and vaping, don't smoke and don't vape. Practice your slip, slop, slap, seek, slide. Maintain a healthy body weight, eat a diet high in antioxidants, high in fiber, etc. Exercise regularly, don't consume alcohol. The only one that should be added to this list, which is not direct, is put yourself through regular screening programs such as Breast Screen Australia, remote bowel cancer. Regular skin checks, and remote bowel cancer screening. So where and for whom are cancer rates different in Australia? So young adults have an increasing incidence rate. This is particularly due to breast cancer. Females have an increasing incidence rate of cancers, so while they still have less than males, that gap is actually closing. First Nations people have a much higher incidence rate of cancers and lower survival rates, and low SES and remoteness, so there has 40% increase in mortality rates for these groups combined. And that was your too long didn't study version of cancer.